Good day, everyone. I'm Pooja Joshi, your host for today's episode. In this session, we focus on a condition that is common yet often misunderstood: irritable bowel syndrome, or IBS. To help us navigate this important topic, we are joined by Dr. Atul Shende, gastroenterologist at Suyash Hospital, Indore, a respected expert in functional gastrointestinal disorders. Today, Doctor will walk us through early symptom recognition, simplified diagnostic approaches, and effective evidence-based management strategies for IBS in routine clinical practice. Doctor, thank you for being with us. Let's begin our discussion.
Namaste, I am Dr. Atul Shende. I am a gastroenterologist. I am Associate Professor at Department of Medicine, MGM Medical College, Indore.
So, doctor, question for you is, what exactly is IBS and how would you describe it in simple terms to a non-specialist?
Irritable bowel syndrome is basically a disorder of large intestine and colon, wherein patients, they come to us with history of abdominal pain, with change in their bowel habits. Either it is a constipation predominant or diarrhea predominant or a mixed type of variant.
In your experience, how does a typical IBS patient present in an OPD?
A typical IBS patient usually comes to us with history of, in preceding 3 to 4 months, patient has history of abdominal pain, which is usually in the morning hours, which is followed by evacuation, and that pain is relieved by defecation. Either it is a loose stool or it is a hard stool. Sometimes patient has intermittent diarrhea or intermittent constipation.
What are the biggest myths or misconceptions you hear from patients about IBS?
The biggest myths and misconceptions which are prevalent in our society is that irritable bowel syndrome is a long-standing, untreatable condition. There is no definite treatment for this condition, and these patients usually they have multiple consultations and doctor shopping, and we see in our clinical practice basically they are been having these misconceptions that there is no permanent treatment or a complete cure for this condition, and we have to counsel our patients that a bit of change in lifestyle, a bit of medication will help them in coming out of their symptoms.
How does modern lifestyle, food habits, stress, and sleep contribute to IBS?
In the modern times, when we see our patients, they usually are either coming from background wherein they are having sedentary lifestyle, they have improper dietary habits, they are taking alcohol, fast foods, they smoke, and they don't have good lifestyle. That is, they lack exercise, they lack healthy food habits. Timing of sleep is very, very important. So timing of food is also very, very important. So all these modern age lifestyle incompatibilities, they lead to worsening or precipitation of the symptoms of patients of irritable bowel syndrome. Intake of high fiber diet, intake of food at proper timings is very, very important in management of patients of irritable bowel syndrome.
What are the top 3 red flags that make you suspect IBS in a patient?
The most important red flags wherein we suspect IBS in our patients is that basically red flags are, or alarm signs are signs wherein we rule out irritable bowel syndrome. Red flags are the symptoms at the index presentation when the patient is seen by a physician for the first time. If the patient has red flags, or for that matter alarm features, that is, if the patient says that I am having blood in my stool, I am having recurrent mucus in the stools, I am having nocturnal awakening, I have lost a significant amount of weight over the past 3 to 4 months, I have loss of appetite, I have fever. So these are all red flag signs which we should consider and ask every patient at index presentation, and then we should rule out that the patient, basically IBS is a disease of exclusion. You have to rule out all the red flag signs, then only we can label the patient after evaluation and investigation that patient is suffering from irritable bowel syndrome.
What are some common mistakes in diagnosing IBS at the primary care level?
It is a very, very important question which you have asked me, because in our clinical practice we see that in even our primary care physicians and general practitioners, they commonly intermix the terms IBD and IBS. IBD is inflammatory bowel disease and IBS is irritable bowel syndrome. IBS is a functional disorder of the gut On the contrary, inflammatory bowel disease consists of ulcerative colitis, Crohn's disease, indeterminate colitis. So IBD is an organic disorder of the small and large intestine, and on the contrary, IBS is a functional disorder, which is a disease of exclusion. So this is the most important mistake which is done at the primary care level, and that is why we should ask our patients to undergo proper evaluation at the outset, so that we are not missing any organic disease of the small as well as large intestine.
How do you tailor treatment between IBS-D, IBS-C and mixed IBS?
Yes, so it is a very, very important question wherein we have to every patient about his symptom profile, whether he is a constipation predominant or a diarrhea predominant or a mixed type of patient. So there is no one single treatment for every patient. We have to give a deep thought to every patient's symptoms and then subsequently treat these patients with appropriate treatment. For patients of diarrhea predominant irritable bowel syndrome, we need to give treatment for diarrhea predominant symptoms. For constipation, we have to give constipation predominant, and all those patients who have got mixed type of IBS, we have to give accordingly. So it is very, very important, not that every patient needs a single treatment. The treatment is personalized depending upon the predominance of the symptoms, and we should give at the same point of time important dietary advices as well to these patients.
What's the role of diet? Do you recommend low FODMAP, fiber modification, or any particular dietary pattern?
So diet has to play a very, very important role in patients with irritable bowel syndrome, especially all those patients who have got diarrhea predominant irritable bowel syndrome. FODMAP has a very, very important role to play in management of their symptoms. High fiber diet is usually advised in patients with constipation because it improves the fecal bulk and their constipation is relieved. We ask our patients to avoid too much of oily, spicy food, junk foods, especially food which are ultra processed and processed foods. They have a bad effect on their gut and gut microbiota, wherein that is why we ask to take the traditional Indian food which suits them and suits their gut.
Do probiotics or prebiotics have a role in IBS treatment?
Yes, there is limited data in most of the trials, randomized controlled trials and studies, but yeah, definitely probiotics and targeted probiotics will definitely play an important role in future for management of irritable bowel syndrome. We definitely use in our clinical practice sometimes probiotics for management of patients of irritable bowel syndrome.
What's the most memorable IBS case you've handled and what did it teach you?
So I distinctly remember a patient wherein he was actually obsessed with his constipation, and he used to say that his body is full of fecal matter. He used to say that if you even cut my skin, you will find that fecal matter will come out of my skin. So he was so much obsessed with his defecation patterns, and he thought that whole of his fecal matter has entered his body. And from this case, I thought that all these patients, they are also psychosomatically burnt out, they are psychosomatically disturbed, they have multiple psychosomatic issues which are to be handled at the same point of time along with their GI symptoms.
What advice do you give to patients for long-term gut health and relapse prevention?
So this goes a long way in management of irritable bowel syndrome. Diet and exercise, these are the two very, very important aspects of management of patients of irritable bowel syndrome. If the patients, they maintain a healthy diet and a healthy lifestyle, management of stress, regular exercise, they have to curtail on their weights if they are very overweight or obese, because these patients, they are obese and then they may be also harboring metabolic associated steatotic liver disease. So we ask these patients to take over a healthy lifestyle, manage their weights, reduce intake of processed, ultra processed food, reduce fat and carbohydrate in their diet. A good protein diet with good amount of fiber is the most important aspect in management of irritable bowel syndrome.
What do you wish every consulting physician understood about IBS?
So it is very, very important at the primary care level when the physician is evaluating a patient of GI symptoms, he should always first at the outset rule out any organic pathology, because we have seen many times patients coming to us with colon cancer, ulcerative colitis, Crohn's disease, who were mistreated and underdiagnosed or undiagnosed, and they were managed on lines of irritable bowel syndromes, and when they came to us they had advanced diseases. So it is very, very important for the primary care level. At the outset, you should rule out any organic underlying disease, and when all the other underlying chronic diseases or organic diseases are ruled out, then we label this patient as irritable bowel syndrome, and then subsequently, so that we don't miss any organic pathology.
What's your vision for IBS management in India over the next few years?
I feel that the percentage of patients is going to rise in the young generation because of the type of dietary habits, because of the type of stress, because of the type of lifestyle which our Gen Z is living at this point of time. So I wish that the young population or the young generation, the Gen Z, should be counseled regarding proper dietary habits, stress management, change in their lifestyle, regular exercises. These are the things which will take our next generation in a long way in having good gut health and good gut microbiota, which will even prevent them from other disorders of the body.
One food you tell IBS patients to avoid?
The most common instruction to my patient is to avoid junk food. Junk foods are actual real killers of the next generation. These are the most important. Ultra processed and processed and food coming from outside containing lots of junks is the most important thing which we ask our patients to curtail.
What's your gut-friendly morning habit?
So the most important things which we practice as a gastroenterologist, in our Vedas, in our Shastras also, it is said that eat less, eat healthy. So it is very, very important that you take meal at proper timing. Breakfast in early morning hours, that is around 8 o'clock. Take your lunch somewhere in the midday, that is around 12:30 to 1 o'clock. And then end up your day with a very small dinner, which is to be, as Jain Dharma says, that you have to take before sunset, you have to take your dinner. So the important healthy lifestyle measures and the healthy habits which usually we should practice in morning hours is that do 30-minute brisk walk, Surya Namaskar for 5 to 7 times, and some aerobics, cardio, or we can play some outdoor high intensity, high velocity game. Take a cup of warm, lukewarm water which rinses your body, and at the same point of time, some good amount of protein is to be taken in your breakfast, especially some sprouts, oats, and some healthy Indian snacks which are very, very helpful in management of irritable bowel syndrome.
Thank you, Doctor, for sharing such valuable insights on IBS. Your clarity and practical guidance will certainly help both physicians and patients approach this condition with more confidence. To our listeners, thank you for joining us. Stay tuned for more expert-led conversations. Until then, take care and prioritize your gut health.